If you're watching this video on the NES YouTube channel, there's more information and useful links in the description below.
Good afternoon, and thank you very much for joining us this afternoon. I'm here to talk about the promise. I want to talk about why it came about, what it is, and what's coming next. So hopefully you, as I am doing, can find the right websites, mailing lists, etc. to be involved in and to follow, to hear about what's coming next. An important venture for us all. But first I'll start by introducing myself. I'm Jo Haddrick and I'm the Specialist Lead for Employability and Career Development at NHS Education for Scotland. I joined NES about 6 months ago in this relatively new role, and before that I spent a few years at Edinburgh Napier, but the majority of my experience in my working life has very much been around supporting young adults who are furthest from the labour market with that journey towards work. So that also took me for about 10 years, specifically into working with looked after children and young people that were in the through care service, what we deemed in England to be care leavers. And therefore, the promise is something that's really quite close to my heart. So I'll start by talking about the context and kind of where the promise came from, say a little bit about the promise, and then talk about what's coming next and what can help. So in the 30 minutes we're together today, I just want to share some of my learning in the hope I can entice you to want to watch with interest and get involved as appropriate to your role. It's definitely going to take all of us to keep the promise. So I'll start by talking a little bit about the Independent Care Review, which is where it began. In October 2016, the First Minister made a commitment to figure out how Scotland could love its most vulnerable children and give them the childhood they deserve. The Independent Care Review listened and gathered evidence for 3 years until just before the first lockdown. This was the start of the journey to figuring out how Scotland could keep that promise as a country and as corporate parents. And this is the phrase, this is the promise that we're talking about, that young people, that children and families are a place where we can grow up loved, safe and respected so that everyone can realise their full potential. I particularly like the Pinky Promise, an important version for children to help them understand what was going to change about their experience and the commitment that Scotland was making to them. In the review, I just want to pull out a couple of things to just to give you a flavour of what was inherent in so many of the stories. So it looked at the human costs and also the system costs. So every year Scotland spends approximately £1 billion of public money on the care system, yet often that system as it currently is fails and doesn't provide the support that people and individuals, that children need. So then we spend money providing additional services, particularly for the adults as their care experience is with them for life. But the human cost, the cost to the care experienced adults is something that having worked with care leavers and care experienced individuals, for me is something that's just unforgettable, and it's really the important driver for the change that we need to see, not just in the system, but in the way we speak about and think about care. If you want to review, you will find that these are mentioned in the publications. One called Follow the Money is an interesting read, which has all of the research behind these statistics. And for children living in the 10% most deprived areas of Scotland are 20 times more likely to become care experienced than those in the 10% least deprived areas. So that's where there starts to be a correlation between care experience and poverty. And these are quite stark figures, and having worked with the education of looked after children in England, really seen the system at a time a number of years ago, perhaps when change hadn't begun, and it is really quite stark to see the impact on a young person's education, of the care experience, of many placement moves, of different changes in caring and caring status, and from that lack of support that is continuous. For many, it's quite a fragmented experience, and these are some of the implications of that. So the promise is a commitment to keep the promise, which was made 5 weeks before the first lockdown. So this isn't about building a new system or changing the care system. It's about a much more radical change so that communities made up of services work to meet the needs of children and families. Services can be accessed by children and their families to meet their needs and wants at the time when they have the need and where they have the need. So the promise has a dual responsibility to oversee and report on progress and support delivery. The Promise Scotland is an organisation in itself, and it has these 5 pillars at the heart of it. So the scrutiny that the Promise Scotland as an organisation brings to this process of driving change is essential to changing on a radical scale. The Promise Oversight Board tracks the pace and the quality of change and reports publicly on progress. And you can actually read the minutes of their meetings, the 5 meetings they had in 2021. It's quite interesting to see how their meetings are delivered. The Oversight Board is made up of representatives from lots of public sector bodies, third sector organisations, and importantly, those with lived experience of care. And they come together to reflect and to focus and to continue to support us to drive the change. So in addition to the scrutiny, they also bring support to the organisations. So to help us, the Promise Scotland published Plan 21-24 last year. And it was a publication which mapped the promises from the care review, the conclusions and the commitments, and tried to make sense of them in a way that allowed public sector bodies in Scotland to really focus. So the fundamentals at the heart of Plan 21-24 are these 5, and everything that the care review sought to recommend, the change that should be brought about, is mapped to these 5 areas and changes in these areas. So the promise is looking at systemic change, it's looking at legislative change, and it's looking at the change that needs to happen within 26 of the 43 directorates in the Scottish Government that have activity relating to the promise. So it is complex. And then there's the local delivery arrangements in local authorities that are being led by COSLA. So this document that mapped the changes is then supported by Change Programme 1. And as I say, very consumable documents that I would recommend to you to consider reading if you haven't already done so. So the Change Programme 1 publication came out in the middle of last year to take a snapshot of progress, what was happening at the time. It was an opportunity for key organisations that are responsible for driving and embedding the necessary change to share their progress, to say what's happening for them, and to say a little bit more about what their intentions were. It's been a challenging time to continue to drive forward with the promise, but the next publication due in spring 2022 should allow us to see a snapshot of the plans of organisations as we move out of COVID and we try to recover from the pandemic and get back on track with keeping that promise. So work is underway on every one of those fundamentals in Plan 21-24. Plan 21-24 is the first of 3 plans that will take us to having kept our promise by 2030. It's an opportunity to stage this process, to look at building blocks, and we as NHS Scotland will inevitably be required to play our part in this. So thank you for joining us this afternoon to start to understand or to continue to grow your knowledge of what's happening to help to keep the promise. So what can we do? As corporate parents, health boards are listed as public bodies that are required to have a corporate parenting plan. This is part of the legislation in the Children and Young People's Act. And these are the areas on this slide that we're asked as corporate parents to consider and to publish a plan. So if you haven't already seen the plan for your board, then perhaps it's a good document to track down and to be aware of. We'll all look at these responsibilities through the lens of the services we provide. So your plan within your board will be about your locality and may be different to the plan in the health board next door, will be different to the corporate parenting, the application of the corporate parenting duty perhaps by NES or by Health Improvement Scotland. So we will all look at it differently, but we can all continue to come together and collaborate. And I spent about 10 years championing corporate parenting, having conversations with senior local authority officials at the time, talking about what it meant to be a corporate parent, and to bring it to life, and always asking that question, would this be good enough for your child? And I've never forgotten that for me, that's the important question to ask myself. If I'm talking about a service or a change or an offering, an opportunity, about access to work, access to healthcare, would I be happy if this was the experience of my child? And it's, for me, always been a good way to consider whether more can be done and more should be done by me, by the team that I'm within, by the service that I work for, and by the organisation that I'm part of. And our corporate parenting plans are the way in which we express this. We report on them and we continue to review and improve them. So it may be something that you want to consider being part of. I would expect most boards will have a corporate parenting group and a very open membership of that for anybody that wants to contribute. Who Cares Scotland are an organisation funded by Scottish Government to provide a range of different training opportunities to corporate parents, and you can access their training and knowledge hub to find out more about the support they offer and the opportunities for Who Cares Scotland to support you, your team, your organisation, your directorate within the organisation. Their toolkit is really comprehensive. We in NES are very lucky to have a member of Who Cares Scotland having joined our team as a business partner. So for us, we're constantly trying to look at new ways in which we can bring the corporate parenting duty to life and involve as many people within our staff and our workforce as possible in carrying out our corporate parenting duty. I also wanted to bring to your attention the Promise Design School. So it's currently in its pilot phase, but this is about applying the Scottish approach to service design. It's about supporting service redesign. And at the moment, the Promise Design School is working with some of the Pathfinder organisations that have the most ability to impact on delivering the promise. But eventually, it will be an opportunity for us all to consider using the tools and the guidance and the opportunities to run a Promise Design School if and when we're considering our own service redesign. It's essential that the experience of care is at the heart of this redesign and that we have a co-design process with those care experienced people that can share their experiences and help us to really research and design new services. So part of this Promise Design School approach is to enable the participation of care experienced people to increase their knowledge of service redesign, of models for working, and of how to drive improvement in the services and the part they can play in that through their lived experience. In NES, we're looking at the moment at our voice strategy to support our employability colleagues across the boards. So for us, you heard voice as what was at the heart of the promise. Voice is about ensuring that everything we do is co-designed with the people for whom we're trying to make the change to improve the service. And as we grow and share our understanding, we hope that we can help boards to also learn and grow with us in terms of their employability services at least. There is a Pinky Promise Design School being developed for children this year. So if you're involved in services for young children or children in general, you might want to follow the progress of the Pinky Promise Design School, which will enable young people to learn about how they can contribute to the redesign of services that are aimed at children and young people. And there is reference to Healthcare Improvement Scotland and NHS having an opportunity to collaborate in the future to bring service redesign into the heart of what we do as a workforce. So I would say watch this space. There's a link we can share to more information about the Promise Design School, and there's newsletters that you can sign up to hear progress. And I also want to talk about Each and Every Child. So Each and Every Child is an organisation that's part of the Promise, but it's also about more than that. It's about reframing the conversation. How we talk about care experience really matters. So we can change potentially the lived experience of children and young people who are accessing services now, but we also need to change the conversation that we're having in our society about what care experience is. You probably already use reframing all the time to represent information, maybe to your colleagues, your children, your parents. So Each and Every Child takes that concept of reframing and understanding the power of communication. It's been generated through research and testing. So for a couple of years, the Reframing Institute was looking at testing different ways of speaking about care with the public. So this is about shifting public attitudes, and one way that we can do that is to find the right language and the right way to speak about it. So it's about changing that stigma. And if there is stigma, it's about explaining and talking about the stigma. It's about understanding where some of our preconceptions come from. And we need help to enable us to do that. And Each and Every Child is the organisation that's currently rising to that challenge. So alongside creating the change being driven by the Promise, we also can contribute as professionals to changing the assumptions of our society by putting the processes and the learning of each and every child at the heart of our services. So it's a chance to tell a news story, and we're all being invited to be part of it through reading the research, understanding the concept, and attending a series of open webinars if you feel it's appropriate to your role and your areas of responsibility. So at the moment, there are events coming up in April that you can sign up for. Thank you very much for joining us. It's been a pleasure to talk to you about something that I'm so passionate about, and I look forward to speaking with you again over the coming years as the Promise progresses and we start to really play our part as an organisation in keeping the promise.
Thank you for your interest in the Promise. If you want to read some of the background or subscribe to newsletters that will help you to keep up to date, then here are some useful links. Why not find out about the corporate parenting plan for your board to see what's already happening locally to support care experienced people? And I look forward to speaking to you again as the Promise progresses.